Hi everyone, I am Dr. Rishikesh and I secured a rank of 314 in recently conducted NEET PG exam. Guys, one of the most important thing that helped me to improve my rank was making concise notes of previous year questions and grand test that I gave during my preparation. Friends, we make a lot of silly mistakes in the main exam, and to prevent that I made this bullet notes of PYQs and GTs. So I will be discussing this technique with you guys in this video. Do watch this video with full focus, friends. So the major advantage of MCQ notes is it really saves your times, guys. For example, when you revise a module of 25 PYQs, it may take half to 1 hour to complete, but when you have self-made notes, you can revise it in around 5 minutes. Second, it helps to avoid your silly mistakes. See, when you solve the same PYQ module after some days, you may make silly mistakes, but if you have the notes, you can visit them multiple times and avoid these silly mistakes. Third point, it helps to analyze the previous year topic and most important topics by yourself, as mostly the exam will contain the previous year topics. So this helps to master your PYQs and avoid the silly mistakes. That's why there are a lot of benefits of making these notes. So now coming to the video, how I make the PYQ and GT notes, now I will discuss with you all. First of all, you can see these are my self-made notes in one page of one module, and I can revise it in maximum 5 minutes. I only write the points that are volatile and revise it multiple times. Use your short forms and make them concise as much as you can. Now I will show one of my GTs that I solved on Marrow. See friends, in this grand test I have made 44 wrong questions. So first of all, I used to review them first. And after that, I also reviewed the correct options and extract the points, the volatile points, the information that I don't know, and write them on a single page. So I will show you them. See guys, you can see this question is a long one. It says a 60-year-old male with sudden loss of vision and with risk factor of atherosclerosis. That is hypertension, diabetes mellitus, old age male. What is the investigation that you will perform? So the clinical case is suggestive of carotid artery stenosis. In my short notes, what I wrote: carotid artery stenosis, CT angiogram, risk factor atherosclerosis. Also from incorrect options, I extract some information, that is ocular B scan is done for posterior segment and the most common site of carotid artery stenosis is common carotid bifurcation. Now when I revise it, I can do the same in seconds. Also do read the explanation part, but include only the volatile points and points that you don't know in your one page notes. Now coming to the second one. Now this question is an image based question and diagnosis is pretty much clear that it is a case of juvenile papilloma or laryngeal papilloma. So this question is a silly mistake of mine and one liner also, as it asks for laryngeal papilloma causative agent, but I marked the answer of genital warts. So what I wrote in my notes, basically I wrote 6 and 11 and side by side I write diagnosis, that is laryngeal papilloma or juvenile papilloma. Also I wrote the point that I made incorrect, that is 16 and 18 is not the causative agent, and in this way I remember the 16 and 18 only for the genital warts and 6 and 11 will work for the laryngeal papilloma or juvenile papilloma. So in this way, I can avoid this silly mistake by reading my notes when I revise it. Now coming to the third one. This is a long question and the question is a suggestive case of ankylosing spondylitis and asks for the patient's clinical finding. So I not know this question and even the options I don't know. So what I wrote in my notes, I wrote all the points of the options that are correct side by side. That is, I wrote ankylosing spondylitis. Inside I wrote the loss of spinal extension slash lumbar lordosis slash earliest manifestation slash bony ankylosis. This one line will cover 4 to 5 MCQs and also helps to avoid my silly mistake. How? Because MCQ may ask what will be lost, either the spinal extension or flexion or the lordosis or kyphosis, and it may ask the earliest or late manifestation, or it may ask what will you see in terminal stage, either whether the bony ankylosis or fibrous ankylosis. So this one line will take care of all such MCQs. You guys should also do this and I feel definitely you will improve your rank for sure. Now the fourth one is a simpler one, and basically it is just one-liner question, but I don't know this fact. The question is regarding the component of rabies virus used to prepare the vaccines. And there are different options of the virus components, and the correct response is glycoprotein G. So I simply wrote rabies vaccine, and inside I wrote the G protein or the glycoprotein. And this is enough for this question. Now coming to the fifth one. Again, this is a long question, and same pattern of long questions, around 40 to 50 questions are asked in this year NEET PG exam. This is a case of tibial fracture managed conservatively with cast for 6 weeks. Now, as the patient is not using his limbs, it will go in disuse atrophy, and the questions ask for the mechanism of the same. I don't know this question at that time, so what I wrote simply, I wrote the disuse atrophy. Inside I wrote increase ubiquitin proteasomal pathway. I also read the information in the explanation, and I can extract it is an ATP dependent process, so I wrote that point also in my notes. In this way, you can revise this clinical question in seconds. And if you think any more information that you don't know, you can write that information side by side, and that totally depends on you. Okay. One more question to explain you guys. This question is all except type of question, and you have to be very careful while dealing such type of question. So the question asked about all of the following tests can be used to check the efficiency of pasteurization except. So I don't know the correct response at that time, and I made this question incorrect. So what I wrote in my notes, basically I wrote the test to check the efficiency of pasteurization, basically these three tests, and I also wrote the option that is incorrect, that is methylene blue reduction test, and I wrote for which purpose it is used, basically to detect the presence of microorganisms. So in this way, when I revise this question, I can revise this question in one line, the correct response and the incorrect response also. So guys, this is the way I used to make my GT and PYQ notes. And also one more tip I want to give you guys, that when you revise it multiple times, do highlight the points that you won't able to recall. So in this way, you are going to revise your PYQ module and GT module in as much quick time as possible. This will help to cover your whole syllabus and also helps to avoid the silly mistakes. So I hope you guys get an idea now how to make your own GT or PYQ notes. So this is all for this video, friends. I wish you all the best for your preparation journey. Be confident, keep studying, never ever lose hope in your life. And do ask me any question if I missed to talk on this topic. And if you like the content, do subscribe and share the channel. Thank you. Goodbye.